My name is Kofi. In this video, I'll be performing oxygen administration. So, I'm basically in the patient's room. I knocked, I came in, I introduced myself to the patient, and I identified with him 2 forms of identification, his name and his date of birth. And I told him that the doctor has put in an order for us to administer oxygen because his oxygen levels are very low. So I'm going to begin with the nasal cannula. I have my supplies here and I have my non-breathable mask. So we're going to first do the nasal cannula. So I'll perform hand hygiene. So this is the nasal cannula. I'm going to connect it to the oxygen flow meter, which is usually green. So once that is connected, I'm going to put this in my patient's nose and around his ears. Then I'll strap it. Not too tight, strap it to give some comfort to the patient. So the flow rate that the doctor gave us was 4 liters per minute. Usually if it is more than 4 liters, if it is like 6 and above, then the patient will need a humidifier. So right now, some hours have passed. I think the doctor wants us to step up the oxygen flow rate, so I'll go ahead and perform hand hygiene. Then I'll unstrap it. Then I'll discard it off. Again, perform hand hygiene. And I'll take the non-rebreather mask. So with this, it has a bag. And it's going to cover both the mouth and the nose of the patient. So I'm still going to connect this to the oxygen flow meter. Then I'll strap it on the occipital area of the patient by placing this on the nose and ensuring that it covers the mouth. Ensuring the patient is okay. And usually these are very uncomfortable around the cheeks and the ears, so I'm going to put some padding on the cheek and on the nose, ensuring that the patient has some comfort. Then I'm going to set the oxygen to 15 liters per minute per the doctor's prescription. So now the patient is doing good, oxygen flowing all right. Now the doctor wants us to take the oxygen out. So I'll come back in, perform hand hygiene, and I'll let the patient know that the doctor wants us to remove it. So now I'm going to take it off. I'll begin by removing the padding. Discard it off properly. Perform hand hygiene. And then I'll exit to go and document whatever I did and how the patient responded to the treatment or the oxygen flow, ensuring that I give him privacy at the same time. And that brings me to the end.